In a previous HealthTree University lesson, we explored how multiple myeloma can be classified into 6 distinct genetic subtypes. Now, it's time to take a closer look at myeloma that displays the translocation 414. What is translocation 414?
So translocation 414 is when chromosome 14 and chromosome 4 merge together. So there's a translocation, meaning a piece of chromosome 4 is now expressed on a piece of chromosome 14. Chromosome 14 is where the heavy chain of an antibody is produced. So not surprisingly, that's very highly expressed in myeloma patients because they're making lots of antibodies. So what else binds with chromosome 14 is oftentimes overexpressed in these patients. So chromosome 4, the specific translocation is an FGFR3 and something called the myeloma SET protein. So those now get overexpressed in myeloma patients. Whether or not this is high risk is somewhat controversial. Originally, it was deemed to be a high risk criteria, and the IMWG added it to the high risk criteria in 2014, and it still remains there.
The IMWG has revised their definition of high risk multiple myeloma. Currently, translocation 414 is considered high risk if it occurs in combination with a chromosome 1 abnormality.
This was before we had a lot of the types of treatments that we use commonly these days. And what we know is that the 414 patients actually respond quite well to proteasome inhibitors. So previously, we thought that 414, well, we knew that 414 was associated with the worst prognosis, which is why it became a high risk criteria. But now with more commonly used proteasome inhibitors, that may not be as much of an issue as it used to be.
Should proteasome inhibitors be used as part of maintenance therapy in patients that have translocation 414?
With the 414 patients, they certainly do benefit from having a proteasome inhibitor as part of their induction and likely as part of their maintenance should they go through transplant. So I certainly would recommend a proteasome inhibitor at least, or a proteasome inhibitor plus an IMiD as a maintenance-based regimen post-transplant in these patients. There are some trials that are currently looking at SET inhibitors in myeloma patients, and those are enriched for patients who have a 414 because, as I said earlier, the SET protein is expressed on chromosome 4, so when patients have a 414, they get overexpression of MMSET. So there are some trials that are currently looking at that specific inhibitors of that specific protein to see if that's going to be effective in myeloma patients. So it's one of the common panel, a part of the common panel that's tested in almost all myeloma patients. It's present in about 15 to 20% of myeloma patients, so it's certainly one of the more common translocations that we'll see. It appears to be something that can not what we would call a founder mutation, so it's not necessarily always present at the onset of someone's myeloma. If you look over time, patients with myeloma have higher levels of 414 than patients with smoldering myeloma, who have higher levels than patients with MGUS. So it seems to evolve over time. And even in patients with myeloma, you would think that it would be more common in patients with more relapsed disease that have been through multiple lines of therapy than in patients who maybe are just newly diagnosed.
Understanding the genetics of your myeloma is crucial. Knowing your risk status can help guide your decisions about treatment and maintenance therapy, and it may also reveal a targetable mutation. To track your genetic profile, sign up for a HealthTree account. Once your medical records are connected, you can view your genetic profile by clicking the Track My Disease button on your dashboard. You can also find personalized treatment options and relevant clinical trials based on your profile. Click the link in the description to join today.